Thank you for sticking around for our Medical Monday interview. Dr. Tara Ballant joins me now from RMH to talk about how to prevent a stroke. May is right around the corner, and that, of course, is Stroke Prevention and Awareness Month. What is a stroke? That's the best way to start.
A stroke is a brain attack. There's two general categories of strokes. One is where the arteries in the brain become blocked by clot or something else, and the brain tissue itself loses the ability to get oxygen and nutrients from the blood vessels. The other category is hemorrhagic stroke, which is where you have a bleeding problem in the brain itself.
Okay, what are the signs and symptoms people can look out for, not only in themselves but also their loved ones?
Important things are if you were to lose, or somebody that you love loses the ability to move an arm or a leg, loses the ability to speak or understand somebody speaking to them, or acute onset of confusion. Those are all big warning signs of stroke.
Okay, then what do you do, I guess, if they start exhibiting those symptoms?
Any of those symptoms is considered an emergency. There are strokes and there are mini strokes, and the only difference between those is the time frame that they occur in. If the symptoms resolve within 24 hours, it's considered a mini stroke. But at the time of onset, no one knows if the symptoms will resolve or not. So you have to treat every episode as an emergency and immediately contact 911, get into the emergency department and start being treated.
Because time is of the essence, right? Every
Absolutely.
minute that passes could be another degree that they're affected.
Absolutely. Timing with strokes is very important because within the first few hours of onset of stroke symptoms is when patients can be treated the most.
Okay, and then speaking of treatment then, what do they do once they get to the hospital? How do you treat something like this?
Generally, you'll have an initial evaluation by the emergency room physician, and that will be a complete physical exam. Probably some blood work will be done. The nurses will hook you up to monitoring, including EKG heart monitoring and those kind of things. And if the emergency room doctor decides that he's concerned that you're having a stroke, the neurologist will be called because RMH is becoming a stroke center. So there's always a neurologist on call. They'll be notified of your symptoms and will start treating you with anti-coagulation medicines, which also are called clot buster medicines.
Okay, so to head this off at the pass, you can also get screened too. And you mentioned,
Absolutely.
of course, that RMH is on its way to becoming that primary stroke center.
Yes. There is screening for strokes. There are some modifiable risk factors. There are things such as irregular heartbeats that can lead to clots in the heart that can leave the heart, go into the brain, and cause strokes. That can be screened for. Also, there's disease in the carotid arteries in your neck that if you have disease or occlusions in those arteries from hardening of the arteries, that can be screened with an ultrasound, and that's included in the RMH vascular screening.
Okay. And then somebody who should be candidate for the screening, for instance. You said someone who's over the age of 55. What else do you need to know? Hereditary too, right?
Absolutely. If you are a patient that has a high incidence of strokes in your family or heart attacks, you should be screened at an earlier age, maybe before 55.
Okay.
But you can talk to your family doctor about that. But also things such as high blood pressure, a history of hypertension, or diabetes, and smoking is a very big risk factor for strokes.
If you're concerned you may be at risk for a stroke or concerned for a loved one, you can call the number on your screen, 540-433-4580. Dr. Ballant, thank you so much for joining me. I really appreciate it.
Thank you for having me.
Okay, and Viet is right around the corner, but first here is a look at your local forecast.